Hi everyone, this is Sean with the MassSupport Network, and we are going to be resuming after a long break the Massachusetts Weekly Public Health Reports for today, Friday, January 22nd, 2021. So since we last had one of these, there have been a lot of changes to the ways that the state reports its data. They now have a very nice interactive dashboard on their website rather than a series of PDFs. So if you want to go to mass.gov and check these out for yourself, I encourage you to do so. That is going to change a couple of ways that I report these here, and some of the things just don't really convey in a visual way as well anymore. But currently, there are just over 88,000, almost 89,000 estimated active cases in the Commonwealth right now. On the left is how things were last time we checked in before the holidays. It's gone up a bit there, perhaps not quite as much as I might have feared, but there's still going down, and we are slightly on a downswing at the moment. Where we stood before the holidays was with 12,000 people and change in quarantine. Now that's about 20,000. So, more than a 50% increase, and that number is going to be a fairly common thread throughout this presentation. Looking at isolation, which is people who have a confirmed COVID case, we had 161 people before the holidays. And now it's, we had 61,000 people, and now we have 90,000 people in isolation. These are confirmed cases, people who have tested positive, not just exposure. Looking at the demographic breakdown by age, there is, well, first you'll note they did change the system. We're not going to have these beautiful purple palettes anymore, but you can see here that there's a significant increase in the number of people younger than 20 who are tested positive. So that is a thing. Now, part of that maybe because we are actually testing more people in that age group. That was for a long time a group that got very little testing because it was generally assumed that they would not be as effective. But given the information that B117, the more contagious virus variant, tends to infect children a little more than the vanilla COVID, there was perhaps more emphasis on testing children. But otherwise, you can see the ratios of ages states have stayed mostly the same there. But of course, everything is significantly more than it was before the holidays. Looking at the age range, as I said, the age has actually stayed the same for the average new COVID case is still 39. However, hospitalization age has gone up by, or certainly gone down by 1 year since we last checked in, and the average age of death from COVID-19 has gone down 3 years in that time, but still staying pretty high up there. Looking at our hospitals, we have now just over 2,000 people in hospitals for COVID-19 at this time. So about 500 more than before the holidays. ICU cases have risen by about 25%, and almost exactly 120 new intubations, or additional intubations, I should say. Most of the people who were, of course, tracked in these numbers before the holidays will have discharged by this point, and several of them will unfortunately have passed away as well. Looking at our contact tracing, the testing turnaround time has only gone up slightly since the holidays. It was actually significantly higher during the holiday period, but it has been wrestled back down. It's only less than an hour longer than it was back then. Just over 2 days is the average turnaround time for getting your test results. Looking at contact tracing itself, so the top bar is where things stood last time we had a report before the holidays, and things are basically around the same level there, perhaps slightly better scales there. We have certainly the last 2 weeks have definitely been a lot more productive. You look at the bottom row there, much higher percentages, even for much higher numbers than in the weeks just following Thanksgiving. So our contact tracing teams have been hard at work and making their way through a lot of backlogs, which is great. However, you'll note there that case outreach completed within the first day is significantly down. In December, 64% of cases were reached within the first day. Now it's only 49%. So they're making their way steadily through them, but it is taking a bit longer. So looking across the state here, this is our map of the incidence rate by county. So that is the number of new cases per 100,000 people in the county over the last 14 days. It's the average incidence rate. So from before the holidays, almost every county has nearly doubled, especially some of the smaller counties like Barnstable and Berkshire are basically double what they were. The only ones that have not had like at least a 50% increase is basically Franklin County at this point, which is of course one of the least populous counties in the state, so has had very few there. But Bristol County, they're seeing over 100 new cases per 100,000 people per day. It's just quite a lot there, and a lot of these are still on the downswing as well from last week. So let's keep our fingers crossed. A lot of these will start trending down in the coming weeks. But still, many of these are just way too high. Looking at our percent positivity, these three lines, the dark blue is the statewide percent positivity. But the light blue is what our higher institution testing is bringing back. And then so the gray line is the state with higher education testing removed. The higher education testing is a lot more screening test, that is testing people who have no reason to think they've been exposed, but are just testing regularly to ensure that their campuses are staying virus-free. So those by design have a lot lower percent positivity. And that means that the actual state average is a lot higher. But now, as you see, the state average has actually come down quite a bit. That peak there is right around New Year's, and things have steadily trended down since then. So it's very good. Greater than 5% is not where we want to be, but it does seem to be that we are on our way to a better point. So looking at our daily averages, it's been kind of a, looking at the last 2 months is an unpleasant graph to look at. But as you can see, there's a significant drop-off following Christmas, just from what having a day of no reporting will do. But you can see we did have a peak there in early January, and that is probably where a lot of the backlogs pushed us, but we have been trending downward since then. And now I normally say the last couple of days on these charts don't pay too much attention to, don't put too much stock into, because there may be some additional cases that haven't come back yet. But this has been a solid 2 weeks of trending downward here. So that is very good. Now, of course, there is going to be some backlog in here, but there is still a definite downward trend we can pull out of that regardless. Looking at county by county, we see more or less that same trend in this last month. Most of the counties peaked in the second week of January there. But you can see a very similar trend there. A lot of backlogs are going to be coming out around this point, and that's going to keep the counts high for a little while. But just make sure you're looking at what the numbers are here. So this is, for example, Middlesex County, which has always been our highest, reaching only 1,200 cases per day. These are 7-day averages as well, so it's not just a single day, which can throw off the numbers, but then steadily trending down for several days there. So almost 400 cases fewer than where it was at its high point, which is a great descent there. But everything else has been steadily, almost matching there. And you can see how this jump is clearly from the backlog because it's across the state. But other than that, the counties are more or less the same there. Looking at the lower transmission counties, and again, you'll see that same pattern repeated there with Hampshire and Berkshire County taking up our middle slots there, and of course, Franklin and the islands taking up the lower parts there. Almost back to where things were at the start of the month there, which of course things were lower because of missed days from reporting, which is actually pretty nice if we can be getting towards the point where we were when we did not report for a day. Of course, we could still go a lot lower in all these areas. So one last thought as we go out into the weekend. This is the cover of the National Strategy for the COVID-19 Response and Pandemic Preparedness Plan. This is the new document that's just put out by the White House, including, it's supposed to be about a 200-page plan. I've only had a chance to look through the overview, which is a slim 23 pages, several points about a very cohesive document so far, but it's just exciting to have this document out there right now. There is a general overall goal we're working towards right now. And for more from the MassSupport Network, you can find us on our website or on social media. And remember, wear your mask, wash your hands, and we'll be here if you need us. Stay safe.